Hello, everyone. Thanks so much for joining us today. My name is Courtney Malberg. I am the Associate Director of Education here at Cure PSP. Today, we have the pleasure of hearing from an expert on an extremely under-discussed topic, which is sexuality and MSA. The program today will be 1 hour long with a question and answer session at the end. If you have any questions at any point during the presentation, please feel free to send them into the chat and we will use the Q&A time at the end to answer the questions that are relevant to today's topic. If you have questions that don't get answered today due to time constraints, or you have a question that might not be relevant to today's topic, we'd be happy to address that if you email your question to info@curepsp.org. The webinar will be recorded and also emailed out to all registrants and posted on our YouTube page for future viewing. So for now, we love seeing where you're from. I see that some folks are typing into the chat, so feel free to continue to do that. Introduce yourself. We love to know who's tuning in. So as you continue to do that, I'm going to introduce our speaker today. Gila Bronner is a social worker and a senior sex therapist of the Tel-Aviv Sourasky Medical Center. She's also the founder and main supervisor of their sex therapy training program. She is the founder and ex-director of the sex therapy services at the Sheba Medical Center and the founder of the Sexuality school at that medical center. In the last 30 years, Gila has been a researcher and a sex therapist specializing in neuro-sexual-rehabilitation. In 2018, she developed a model for open sexual communication for that's always a tough word for me, multidisciplinary staff, including neurologists. This model is published and used widely. In addition, she has published over 30 scientific papers, 13 chapters in neurological and neuro-rehab books, and created sex education books for children, teens, and adults. Her life goal is dedicated to sexual health promotion by training physicians and other healthcare professionals all over the world. I've had the pleasure of knowing Gila for a few years, and I'm so excited to have her here today. So, Gila, I'll pass it to you to take away.
Hi. Yeah, so thank you very much for the honor of inviting me here. And actually, I would like to talk to you today about intimacy and sexuality in PSP, but also generally in other neurological diseases. I start with a disclosure and, a summary remark. And you can see my disclosure, and I decorated it with pictures from lectures all over the world. And what I want to disclose first, that I have nothing to disclose, but I wanted to say that this talk is relevant to all couples, to all couple diversity. I mean, a man with a woman, a man with a man, a woman with a woman, a person with himself, any sexual and intimate combination or activity, but it is difficult to give a lecture and saying he and she and she and she and he and she. So that's why I usually take one model of couple, meaning the heterosexual couple, he and she, and most of my example will be about that, but you have to know that my talk is relevant to all of them. Okay, so let's start. I am basing my lecture on my experience. So when I talked about management of sexual and intimate problems in Parkinson's disease and in Parkinsonism, I base it on many long years of experience, research work, but also a teamwork, interdisciplinary work in two movement disorder excellence centers in Israel. One is the Tel-Aviv Medical Center and the other one is the Sheba Medical Center. So let's start. The first question is, why should we discuss sexual health, sexuality, and intimacy? And the first reason is that it is important. And actually, I gave you here a picture that I took when I was speaking in South Korea in an international movement disorder congress, and I found this special erotic history museum, and we can see that sexuality was important along history, along all life. So It is not only important generally in life, but also for patients and partners. For example, if we look here down here at a study where people with Parkinson were asked to rate their sexual dysfunction, they rated it as the 12 out of 24 most bothering symptoms of the disease. And when they ask people who had spinal cord injury, and they tell them, can you rate sexual satisfaction? And they rated it as one of the 5 most important needs for their rehabilitation. So people think about it and feel that it is important. The second reason why we should talk about it, just a minute, before the second reason, I would like also to mention that it is also important to older people, and older people are sexually active. In a study which was published in 2015, and it was a United States National Survey on Sexual Health and Behavior in Older Adults, they found out that the group age was at the age of 60 to 69, 53% of the men, here is the column of the men, and 42% of the women said, yes, we are still active. And when they looked at the older group, those who were 70 and over, 43% of the men and 22% of the women said, yes, we are still active, sexually active. And when they look at another study, which was also in the United States, asking older people, those who were 57, at the age of 57 to 85, and they asked about over 3,000 men and women. And they asked them about every sexual activity, like solo sex, partner sex, intercourse. Intercourse, I mean when you have sex without the penis visiting a vagina, okay? And when they asked the people, are you still active? 73% of those who were between the age of 57 to 64 said yes. And about 53% of those who were at the age of 70, between 65 to 74. And look at the older group, those who were over 75. 1/4 of them, like 26%, were still sexually active. So it is important. We are not talking about something which is rare. You don't see it at all. So what is the second reason that we should talk about sexual health? And the second is that patients say that they want information. In a study which was in Belgium, they asked 100 people with Parkinson, and 58% of the patients said we want information from our neurologist about sexual health. And 60% of them said they have never received any information. Another study was in Israel, in the Tel-Aviv Medical Center, in the unit of movement disorder, and they asked 100 people with Parkinson. And 70% of them said, yes, we want to have sexual health counseling. We want to have it from our healthcare providers. It can be the physician, but also the nurse, the psychologist, or anyone else. So people want it. What is the third reason that we should talk and discuss sexuality? And the third reason is because we find that sexual satisfaction predicts life satisfaction. And it was found in the study of 83 adults. All of them were over the age of 60, and they didn't have a specific disease. They just took a representative group from the population. What they found else in this study, which was also very interesting, was that these old people said, you know, we are less concerned with the frequency of our activities, of our intimate activities. They also said something else. We choose what is possible and what affects our pleasure. And we choose activities that are pleasurable for us. We adapt them to the we adapt the intimacy to our age, to our capability, which was very interesting. Meaning that we don't have to stick to these, rules that when you are young, you think you must have an erection, and you as a woman must have a wet vagina, and the erection must visit the vagina, and we must have an orgasm at the end. No, we can think of what is pleasurable for us and choose it, like we do in other areas of life. When we got older, maybe we don't like to go to some pop concert where 30,000 people are there, but we will listen to a concert at home. And maybe we don't like to eat food which is too hot or too spicy, or maybe too difficult to digest, and we will choose according to our age. But when we reach to sex and to sexual life, nobody talks about it. Nobody gives us permission to choose the pleasure. So this is one of the reasons that I talk to you about this. Let's look further to the next reason, number 4. We found that sexual life protects from cognitive decline. Can you imagine? So what they did, they took 155 people, all of them were married, and they were over 60. And they were cognitively intact at the beginning, at the baseline. And they asked all of them, how much satisfaction do you have from your intimate and sexual life? And they followed them for 10 years. And after 10 years, they checked cognitive impairment and dementia. And they found that about 1/3, 33.5%, or 52 out of those older adults which started the study, they had cognitive impairment and dementia. But they looked, who are they? And they found that the greater sexual satisfaction at baseline, the less decline, and better cognitive function after 10 years. So this is really interesting. Another study asked, is sex good for your brain? And this was a United States national longitudinal study on sexuality and cognitive function. And what they found, that among the very old adults in the study, those who were 75 to 90 years old, those who had sex more frequently, when they checked them 5 years later, they had better cognitive functioning in comparison to those who had no sexual activity. So it gives us some important issue. Maybe hugging, touching, being aroused, maybe getting sexual satisfaction, maybe reaching orgasm, maybe it has a contribution to our health. And this is the fifth reason. We do have health benefit. Sexuality contribute to our health. And soon we'll see what. But in order to see the health contribution and the health benefits, I have first to tell you what is sexuality. What do I mean when I talk about sexuality? So sexuality is much more than just having sex. It can be, as you see in the pictures, sexuality is not only intercourse, it's really much more. And let's see, and I would like to show you the 4 aspects of sexuality. The first 3, the physical aspect, the intimate aspect, and the emotional, spiritual aspect are not erotic. Let's look at them. The physical aspect is actually based on touching, on hugging, on cuddling, on caressing. I can touch my children, my dog or my cat, a good friend, my spouse. I can hug with them, maybe caress them. This aspect of sexuality gives us the confidence that we are loved, that we are respected, that we can trust someone. It gives us a good feeling, a feeling of worth, of self-esteem. And it is not erotic, meaning that hugging or touching does not automatically take us to the erotic aspect. We have another aspect, the emotional and the spiritual aspect. And this has to do with loving, with liking, with trusting. And also this aspect gives us a good feeling. You know, the feeling that we love someone or someone loves us. Or we like someone and we do for this someone things that maybe we wouldn't do to someone that we don't respect or feel any emotion to them. For example, I can stand in the kitchen and prepare a good salad, even if I'm not hungry, just because I know that my family would like it, would enjoy it. Also, the emotional aspect doesn't have to be erotic. And then we have the intimate aspect. The intimate aspect has to do with sharing feeling, sharing thoughts. We cannot do it with everyone. We need someone that wants to listen, someone that does not immediately judge us, but we listen. We can encompass it. We can do it in a respectful and empathic way, supporting what is sharing. And this is the intimate aspect. And also this, I can do it with a friend, sometimes with my doctor, sometimes with my partner, sometimes with my kids or parents. And then we have the erotic part. The erotic part is when we are physically attracted, when we are physically aroused, when we are stimulated. And we can be sexually stimulated with orgasm, without reaching orgasm. It's okay. Now, what is the main problem today over the whole world? The problem is that in some way, all these aspects were connected, together as a deal, as if I touch or hug or feel or love, I must have sex. I must have the erotic part. And you know what happens? I'll give you an example. Let's imagine that I want to hug my husband. But let's imagine that whenever I hug my husband, he perceives it as if it is an invitation to have sex. And if this is what happens, then I will not hug him when I'm not planning to have sex with him. So maybe we hug rarely. And also vice versa. If he believes that he can hug me only when his body or his genital are prepared for having intercourse, then he will not hug me. Only when we go in bed and we plan, or he plans, to have sex with me. So this is one of the problems. And I think that one of the things we have to do is to separate them. I mean, we can hug, we can love separately without connecting everything to the erotic part. And when this is the way that sexuality is in our life, we are much happier and we have much more satisfaction. So after explaining to you sexuality, I want to explain you the sexuality health benefits. So imagine the brain. And the brain, is like a lab which can produce a lot of drugs. Happiness drugs, stress drugs, we call these drugs hormones or neurotransmitters. So what happens in sexuality? Happiness hormones increase. For example, endorphin and dopamine, which increase our feeling of happiness and euphoria. And it increases oxytocin and serotonin, which increases our feeling of empathy and generosity, and all of them reduce pain. And they reduce not only physical pain, but physical pain and emotional pain. We feel good. At the same time, there is a decrease of the stress hormones, for example, the cortisol and the adrenaline. And what happens when these stress hormones decrease? The stress decreases, the tension decreases, blood pressure decreases, and actually our immunity system is increased, is better. When does it happen? All this magic, when does it happen? It happens whenever we have sexuality, when we hug, when we kiss, when we cuddle, when we caress. It happens also during sexual arousal and activity. It happens also during orgasm. But it also happens when we feel loved, respected, and secure. I mean, the levels of the secretions of these hormones is a little different, but we feel good in all these matters. And I think that no neurological disease, not Parkinson and not Parkinsonism, not PSP and not CBD and not MSA and not any other neurological disease should decrease our right to have sexuality in the levels that we can be in them, according to our capability, according to our relationship. So I want to give you homework. I mean, nobody will check. But if you can find someone that you can hug, I mean, someone that you feel good enough to invite for a hug. So 1 hug a day for 1 minute will do the same. Will create increase of happiness hormone and create a decrease in the stress hormones. How do we hug? Actually, this is a specific meditation. Yes, a meditation, hug meditation, which comes from the East. I mean, from India, from China, from the traditions, the old tradition of meditation. So if you look at the picture here in the right, this is the right hug. You put one hand below the neck, as you see here, and the other hand where the belt is, down. And both of us do it without moving, and we lean our head on the shoulder of our partner for the hug, our hug partner, when we just breathe together for 1 minute. We take breath and we let the breath out. That's all. After 20 seconds, hormones begins to increase, the good ones, and the stress one begins to decrease. And after 1 minute, we feel good. It is so important that a few years ago, a free hugs association was created all over the world. If you open the internet, you can find them. And people register to this free hug association when they are ready to give hugs. And when they need a hug, they look for addresses. Where can I get a free hug? Now, in February 2020, I was in a visit in Germany, in the city of Munich. And when I came to the city center, it's beautiful. It has all these huge buildings around the old building. Suddenly, I saw this man with the orange coat and a red hat with the sign "Free Hugs." I came to him for a hug, of course, and I asked him. And he said that he is a teacher in high school. He teaches music. And every weekend he go to the center of Munich, he stand with the sign of the free hugs, and whoever need a hug, he just hugged him. Since after February 2020, we had the coronavirus all over the world. I don't know if he still stands there now, But this was just in the beginning when this epidemic started. So after having one hug a day, we will continue, and we will continue to see what happens in PSP, what happens in other neurological diseases like Parkinson, and what do we have. So first look at number 6. Number 6 is again a reason why we should discuss sexuality and sexual health. Because sexual dysfunction is really common in Parkinson and Parkinsonism. Over 50% of people report on sexual problems. It's a lot. Now, why? What happens? One of the reasons is the motor symptoms. The other factor is all the non-motor symptoms. They affect intimacy, the non-erotic part of sexuality. They affect sexuality, the erotic and the non-erotic part. They affect couple relationship. And we have to talk about it because there are so many myths. I mean, like garbage information. We have a lot of fake information today. So it's another reason to talk about it and to understand how all of these affect. So first I give you numbers. The research, the studies that I present here were done on people with Parkinson, and about 40 to 60% of the men reported reduced desire, and also 70 to 75% of the women. It's a lot. Erectile dysfunction was reported by 54% of the men to 80%. It's a huge number, because the numbers among younger people is about, among young people we don't have a lot of erectile dysfunction, but let's say among those who are at their 50s or 60s, the numbers are less, are 40%, 30%, depends on the health. Women have problems with vaginal dryness and pain. There is another problem of premature ejaculation among 40 to 50%, and inability to reach orgasm. So we understand that the problem is really frequent. So why? Let's look first at motor symptoms. If you suffer from tremor, if you suffer from rigidity, if you suffer from problems, slowness or stop of your movement, you don't control them. If you have problems with walking, if you have problems with standing, postural instability, if you have problems in speaking, in talking, in swallowing, then you have major difficulties in your ability to hug, to caress, to cuddle, to masturbate, to move into a sexual position. Sexuality is moving, is touching, is having specific position. Let's say that you can find a good position, but you have to stay there to be concentrating in a kind of rhythmic movement. And motor symptoms interfere with all this. So we have to think of solutions. And many times you work with a physical therapist who will help you to get up from your chair or to move in bed, but not to move in intimate issues or intimate activities. Nobody talks about it. So we get sometimes solutions, but not specific solution to support our sexuality. As I told you, the erotic and the non-erotic. Now let's look at non-motor symptoms. For example, depression. Depression is quite frequent about people with neurological problems, anxiety, apathy, cognitive impairment, problems in communication, decreased attention. All these are needed, because if I'm depressed, I cannot do something. If I'm, apathic, or if I cannot concentrate, or if I cannot communicate with my partner, then my desire will be reduced, my arousal, the attraction. Some people have change in their appearance. Sometimes the face change their expression. Sorry, I'm just taking a drip of water. Sometimes the way we look, we are less attractive. Some people have neurological problems like frequency, urgency, incontinence. We have to think how we solve it when we want to have sex and touch our genitals. Okay? Then we have sleeping problems. And you know, there is something very interesting. Most people think that they have sex in a very natural, not planned way. But actually, most of the people have sex in bed a few minutes before they go to sleep. But what happens when you don't sleep in the same bed? Because the problems in sleeping, sleep problems in one partner affect the other partner. And sleep is very important. So many times we sleep in separate beds or in separate rooms. So we have to think, when will we meet for intimate activity, erotic or non-erotic? So we have to think, how do we do that? And we have to plan it. And if you look, for example, on non-motor symptoms in PSP, in 2 studies which were published in the 2020 and 2016, and what they see is about almost 83% of the people with PSP had sleep problems and fatigue problems. And 72% had mood problems and cognition problems. And 70% had sexual dysfunction, because all these affect. And we have to think how to keep this part in our life, to keep it alive. And there is another issue that I have to tell you, that when we deal with sexual dysfunction, there is a domino effect. What do I mean? For example, let's say that a man does not have a desire. The lack of desire will affect his erection. He will have erectile dysfunction. And sometimes it will affect the woman, and she will have low desire, or sometimes she will have pain. Or maybe he has erectile dysfunction, which will affect his and her desire. So we have effect on a couple. We don't look only at people who cope with the disease. The partner is also affected. That's why in sex therapy, many times I invite the couple. I don't work only with the man or the woman. So let's say, how do we talk about it? Let's say that you understood the concept that there is a problem and you want to talk with someone. How do you do it? It's a sensitive issue. So let's make it simple. And I want to give you 4 steps. The first step is find the right person. Find the right person that makes you feel comfortable, empathic, confidential, and non-judgmental in the way that this person responds to you. It can be one of your health professionals. It can be someone else. Find the person. But it's not enough. You have to prepare yourself. Formulate your request. Be focused. Think, what do I expect? And if possible, write it down. I don't know what happens to you. I can tell you what happens to me. When I come to my doctor, let's say that I have a headache, okay? But I also have another problem. Sometimes when I eat, I don't have a good feeling in my belly, and sometimes I don't sleep well. If I don't write all these 3 issues, I forget. I only talk about one of them. So write down your question, or write down what you are hesitating about. Then at home, practice it out loud. But why? Because most people are not used to ask sexual questions. How do I ask it? How do I talk about the intimate issue when I'm not used to talk about it? Or discuss it with someone that it is comfortable, with a good friend, with your partner. Practice uncomfortable words. And then if you need your doctor or your health practitioner, tell them that you need extra time, because it takes time to think, to ask the question. And I must tell you that sometimes they will not give you a solution. but maybe they will refer you to the proper person who might give you the solution, the answer to your question. But then I want to help you to maintain your intimacy with your partner. So we have four levels that you can maintain intimacy with your partner. But for this, we need a good communication. So how do we do it? For good communication, we need a few things. First, you have to set aside time. You need time. You need to talk, to share. You need to listen, not to give advice immediately. So find the right time, 5 minutes, 10 minutes that you can talk. Tell your partner that you want to share something. And ask that try to have communication with empathy. Empathy meaning that we are not judging, we're listening. Even if I don't agree with you, let's say that I'm angry about something and I share with you, and you think that it's silly to get angry because of such an issue. But don't tell me that it's silly. I feel angry. So be empathic with my anger and try to get closer. So this is the first way to maintain intimacy. And if you have a problem in having good communication, find a professional specialist in communication. For example, a couple therapist, a psychologist, or maybe a sex therapist to help you communicate. The second way is I want you to practice. This is something you can do alone in order to maintain intimate activity. You have to practice your senses. Don't forget. I mean, practice your 5 senses, see, smell, touch, hear, and taste, but also imagination. And I want to give you a very short exercise now. I'll show you a few pictures and try to smell them. Try to feel the taste or try to hear the noises, even if it's just a picture. Imagine, okay? So I'll go slowly on some pictures and I will not talk. Try to feel the taste as if you have it. The energy, the sound of the waves. The happiness of the movement of the activities. And try to do it yourself. When you take a shower, feel the water. Stop for a few seconds to feel. Many times we are so practical. We do things quickly. We do something, we move to that. I say, stop, smell, breathe, feel. We need it. We need it for our happiness. We need it for our relaxation. The third, number 3. Investigate your intimate needs, meaning think about yourself. What do you need? And remember that when we have a problem like a neurological disease, which actually is progressive, and sometimes couples are stuck together, we need to find personal time for the partner who does not have the disease and for the partner who lives with the disease. Use it for shopping, walking, relaxing bath, dancing class, meet friends, listen to a lecture on the YouTube, on your internet, take a course, read a book, go to swim, play the guitar, and talk about it to your doctor or health professionals if you need. So this is number 3. And now I would like to show you a piece of video, which gives you also some solutions. I think I cannot know. Through this, I cannot show it. So what I would ask you, if you would like, you will open the YouTube and right there, the right to touch and enjoy in Parkinson. And you will see this movie, which I made with 2 professionals. One is an occupational therapist and one is a couple therapist and sex therapist. And we were discussing the right to touch, the right to love, the right to have sexuality, even if you have a disease like Parkinson and Parkinsonism. And then I succeeded in recruiting 2 of my friends, Dr. Tiki Adler, she's a couple therapist, and Zeev Adler is a touch and massage instructor. And they play pieces of ideas how to cope with off time, with problems in movement, in order to hug and in order to touch. And I hope that you will enjoy it. And the fourth section of how to keep your and maintain your intimacy is don't forget to smile. Don't forget to laugh. I'm sorry for the mistake, for the typo, at least once a day. Sit together and look at movies or at YouTube's. Look for funny stuff, because the news bring us all the sad stories from the United States, from all over the world. And since laughter reduces stress and improves our immune systems, and when we laugh together, we feel good together. So I invite you to do this. And thank you very much. This is the end of my speak. And now we can open to some questions or remarks. I invite you. I invited you also to see some pictures of Israel. Some of you have never been here, so I showed you some of the tasty part and the viewpoints, and I hope you enjoy them.
Olives are my favorite food, Gila. So that makes me want to go buy some olives. Well, thank you so much for that presentation and explanations. It was very well done and we appreciate it. So I'm going to ask you a few questions that we received on registration when people registered for this webinar. And reminder that you can ask questions in the chat and we will get to those as well. So the first question I want to ask you, Gila, is somebody had asked if you have any advice because their partner is exhibiting new sexual behaviors that can make people feel uncomfortable.
Courtney, just a minute. Can we take off the slides or we need the big...
Oh, there we go. Perfect.
Yeah,
now we can see each other, yes.
Sorry, can you repeat the question?
Absolutely. So someone had mentioned that their partner is exhibiting new sexual behaviors that are a bit inappropriate at times and make other people uncomfortable. Do you have any suggestions or recommendations there?
Yeah, I assume that they are referring to what we call sexual preoccupation behavior or hypersexual behavior, or harassing other people, or remarking sexual remarks. So what we have to see to understand is 2 things, okay? Mm-hmm. If we have some cognitive impairment or the beginning of dementia, one of the problems of dementia is that there is a destruction of the inhibition part of our cortex, our frontal part of the brain. The frontal part of the brain is this part which, tells us, Gila, it's not nice now to take your finger and put it inside your nose. This is not the right time, maybe when you are alone in your toilet, okay? Mm-hmm. So when this is destroyed, sometimes people what they think, what comes to their mind, does not go through screening of inhibition. And if this is the problem, we have to consult with the proper psychiatrists and neurologists to see if we can do something, okay? But there is something else. Some of the people with Parkinsonism and with Parkinson's disease receive as medication, receive dopamine agonist, meaning dopaminergic treatment. Dopaminergic treatment increase the desire to search something, to do something. And many people encounter with impulse control activities. Some of the impulse control activities have nothing to do with sex. They will be, for example, gambling or shopping too much, or spending money too much, eating too much, painting all the time, playing the guitar without stopping. Okay, these are impulse control behaviors, but some of them in a lower percentage have to do with sexuality. And in these cases, we have to recruit all the staff to talk with the people who treat you and think of a program. Usually they will change the medication. They will not reduce it, but they change the way they give it. For example, today you can inject the medication for the disease through your intestine, sometimes through specific pills that are not absorbing immediately but slowly. So, but you have to tell someone, you cannot cope with it alone. It's very difficult to cope with it. I mean, you can say stop. When it happens, stop it. Stop it by stopping. Like you stop a child. Imagine that your child is going too close to the, to the edge of something. You are afraid that your child will fall. What do? You shout, say stop. This is what you do in sexual behavior, which is not at the right time. So we have first to practice with good stops and then to talk to the staff.
Great. Okay, great, Alex. Especially your point about extended release medications and talking to your neurologist. It's a great recommendation. Yeah. Okay, the next question I have for you is, do you have any recommendations? You gave a lot of practical recommendations for modifications to touching. What if one partner is not interested in touching? Is there a way that you can modify that? Or maybe that goes back to the couples counseling. I'm curious on your thoughts.
When people do not like to touch, there is a reason. So usually we check the reason. For example, if I know that when I have sex with my partner, and let's say that my partner is older, is not at his 40s, he's at his 60s, let's say. And let's say that sometimes his erection is not strong enough. And when his erection is not strong enough, after that, he goes depressed for 2-3 days and he blames himself. And so I say, wow, maybe we don't start touching. So I have always to find the reason. Sometimes whenever I touch my partner, he touches me in such a way which does not feel pleasant for me. I mean, maybe too strong, or maybe in an area that I don't like. So we have to communicate. So maybe I have to help them to communicate. So when someone does not like to touch, usually there will be a reason behind it. And usually I have to find the reason why, because the need to touch is so important for our health that I would like the touch will be in your family, in your life, but we have to plan it properly.
Yeah. What I'm hearing for the first two questions is communication. That's what I'm.
Yeah.
Okay. This one is a little bit more practical, but do you have any recommendations on how physical therapists, whether a rehab physical therapist or a pelvic PT, can help with these sorts of discussions and issues?
How physical therapists can discuss the issue? I mean, if those who listen to me are health professionals, I have developed a special model how to open a discussion with patients. And the best tip that I can give for short, in a short answer is tell your patients, let's imagine that I talk to you, Courtney. Okay, and let's see that it says that you are the patient and I'm the physical therapist. The best way is not to ask, do you have sexual problems? No, don't say it. The best way to say, Courtney, most of the patients here have problems in their intimate life and in their sexual life. If you ever want to ask anything about it, tell me. And let's say that you tell me, I have a question. Then I say, look, I'm not a sex therapist, but thank you for asking the question. Let me check who can give you the best answer, or let me find for you the solution and I'll bring it to you. I will inquire it for you. Now, what you can do as a physical therapist, you can, if you want, write to me. You have my mail. You can write to me and ask a question. I'll give you an answer. Or you can look for it, for example, in the Parkinson Foundation, the American, in the Canadian Parkinson disease site, and in the European Parkinson disease site, there are a lot of articles about sexualities. Most of them I have written, but some of them others wrote them, and you have answers. So sometimes this will be the answer. It will be there.
Okay. That's helpful. We received a really great question in the chat just now, going back to my comment about communication. Do you have suggestions when communication is impacted later in the disease journey?
When someone cannot talk.
Verbal communication, yeah.
Yeah. Look, I was working, I remember that I was working with a couple where he could not talk clearly, and he was in advanced stage of his disease, and he mumbled in a way that he was not clear. And what we suggested is to find physical signs and other ways. He wanted to tell his wife that he loves her, and he appreciates all the effort that she is doing for him. So what we did is we prepared notes. We asked him, what would you like? We showed him a lot of sentences, and it shows, I don't forget that I love you. And I want you to know that even if you don't see it, I appreciate so much the fact that you are with me. Mm-hmm. And if I could hug you, I would hug you. So he prepared this, and he had this in printed note, and he could take them out whenever he could do it. The other way is by holding hands. And this is exercise that I sometimes do with people. When a couple sits in front of me, and I mean physical therapists can do it, every health professional can do it, I tell them just to hold hands. And I tell one partner to touch the other partner in such a way that touch the other partner, and through the touch, send your love. Or through your eyes, look at the eyes, look, and send your love. Mm-hmm. So it's like we look at a baby. Do we need the baby to say, I love you, mom? No. Mm-hmm. You look at the eyes, you look at the smile, you feel the touch, when a baby holds your fingers, hold the finger, it feels so good. So we can just steal these ideas. They work on our brain greatly. They work on our heart. They are really good solutions.
Absolutely.
And I don't know if we will have a question about this, but we have to think about the caregivers.
That was my next question.
So ask your question. Ask it.
I was more so going to just ask if you had a partner to care partner, but anything you have to say, I'm sure folks would love to hear.
So I'll say what I wanted to say about care partner.
Please do.
Care partner are transparent. We don't see them. And this is very difficult. Mm-hmm. We have first to care for your health, and we have to care for your time. You need this, the time that I said, a separate time for yourself, personal time. And you need the touching and the hugging. It's important also for your health. And I think that one of the problems is that we as health professionals don't always look at the partner side. We don't care for the carer. And what I think is, you as care partners talk to the health professionals and ask to be listened to and to find the best way to keep your intimate relationship with your partner. It's not easy, because sometimes you have to wash your partners, and sometimes you have to change diapers, and sometimes you have to clean the face from food because the muscles doesn't work well. And sometimes you don't have time for yourself, and you need time for yourself. And actually, one of this thing, I don't know if you can do it in the United States. Really, I don't know, because of the way of your healthcare insurance. In Israel, the moment that a person is ill and needs help, you get a support from the country, and you get a foreign carer in your house. You can get it for a few hours a day, and when the situation is more serious and there is a need for more help, we get someone who will live in our house, and we don't pay much. We pay very little for that. The country supports it. And this helps the couple to keep their relationship separately from the treatment. So it's not like one of you are treating your partner like cleaning and taking care, but you can be a couple.
Yeah, definitely works a little differently in the United States, but there are opportunities. I'm going to quickly plug Cure PSP's respite care program. You can, pardon me, excuse me, apply for a grant for 100 hours of in-home care. So I'm going to plug that really quick, because we think that's very valuable. And Gila, if you have a few more minutes, I want to ask this last question. Do you have a few minutes to run over? Okay.
Yeah.
If one partner, I believe this is the care partner, is afraid of hurting and harming the person physically with PSP, CBD, or MSA.
What do you mean hurting?
I think maybe during an intimate act, or just even being intimate, like hugging and touching. Maybe a fear of the fragility, or if they recently had a fall, being sensitive to that.
Look, usually, let's start from the easy part. Okay. If I'm talking about a hug, and you saw a hug when a couple, I showed you a picture of a couple who is standing. So if someone does not have stability to stand, we do the same by sitting. For example, I sit, and my partner can sit in front of me, and the hug will be by sitting. The hug can be when we lie near one another. If there is a feeling that maybe we cannot do intercourse because maybe the pushing of the penis in the vagina may create some pain or discomfort, we can use outer course. We can just touch one another genitals if we want to be erotic. If we want to be non-erotic, then we can lie near one another. When we have problems with our skin, and let's say that the skin is fragile, we can use oily stuff, which is very nice. If our hands are rash, from work maybe, we can use gloves. One of the things that I always say, that today with the new materials that are produced for cleaning, for rags, everything, it's great. We can use, I can show you just a minute. I'm going to the shelf because I have it always on my shelf. I love one of these dust cleaning gloves, and I'll show you it. You see the glove?
Oh, yeah. Yeah.
So one side has this, you see? It's very nice. So I don't use it for dust and for skin. This one will stay just for the skin, and you have it in various colors, and you have it in various sizes. There are small ones and big ones, and they are pretty. So
it's a great modification, yeah.
So if, for example, I'm afraid and I need a very gentle touch, then I can use them. I always say, go to the sex department in your supermarket. The sex department is the cleaning material.
That's a pro tip.
I don't think that in supermarkets you have sex departments.
Mm-hmm.
but the cleaning, because of these new materials, they are so soft and nice that we can use them, really use them. We use them when people have, even problems with their ankles, difficulties to move fingers, when they have tremor. So you don't feel the tremor because inside the glove you feel a smooth touch. So just use whatever you need. Why not? If we can use a wheelchair for moving, or a walker for walking, if we can use a mixer in the kitchen or a food processor to cut everything, why not use whatever possible in our intimate life? But there is an obstacle.
Outside the box, yeah.
There are many obstacles because nobody talked about it.
I agree.
So we'll start talking about it.
Yes, and I encourage you all to talk to your healthcare professionals, as Gila mentioned. It's only going to be taboo if we allow it to be, I suppose. Okay, well, Gila, we are over time, so I'm going to wrap it up, but I so appreciate you discussing this with us. It's been a pleasure. I hope everyone watching and everyone watching in the future learns something, and I actually know they will. So I appreciate your time so much. And with that, as a reminder, this will be emailed to you all, and this will be on YouTube for future viewing, so you can share and watch it. We greatly appreciate it, and we'll see you in April for the next Ask the Expert.